Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, what started as a small building in downtown Reno with just a few patients is now a state-of-the-art full-service medical center that sees nearly 10,000 patients a year, many of whom are underserved or uninsured. And now it's growing even more. Sharon Chamberlain, CEO of Northern Nevada Hopes, is here to talk about all of that. Sharon, thank you so much for coming on the show.
Thank you for having me.
Exciting times at Northern Nevada Hopes.
It is.
All
lots
sorts
of growth.
Yeah. I mean, so the first time you came on this show, you guys were a little house in downtown Reno, and now you have this huge, beautiful facility on 5th Street, and now looking at expanding even more. So tell me about the new expansion plans.
Well, we recognize that there are just continues to be so much need for people in accessing medical care and behavioral health services in our community. Right now, we turn away about 80 patients a day that are trying to establish care and don't have somewhere else to go to get this. And so we took an opportunity and looked at it and said, how can we help respond to this community issue? And we had to move admin off-site. We're now down on East Liberty Street, and that allows us to add about 12 more providers, both behavioral health, psychiatry, and primary care services. We'll be able to have, an additional 30,000 patient visits.
30,000?
Yes. Wow,
that's a lot more.
It's a lot more.
And then would you say at that point you're coming close to meeting the need, or is the need still way bigger than that?
You know, our community is growing and expanding. In addition to that, we're having a lot of individuals coming into the community that are having jobs that aren't paying super well. And so, you know, what was one of the pieces when you have to put the food on the table, you have to get your kids' school supplies, take care of all of those parts, pay for gas, pay the rent. The piece that falls onto the back burner often is the medical care or behavioral health care that you need. So I think that we're going to continue to see a need for more growth.
Right, and you see that with populations like kids a lot of the time. You see it with transient populations, and obviously uninsured or underinsured people. A lot of people are struggling to afford their own health care everywhere, but really here it's a big problem.
Yeah, it really is. And another problem that we face that's unique in Nevada is that we're in a we have a lot of provider shortages. So we don't have enough providers to meet the needs. And so especially when you're looking at things like behavioral health services, bringing clinicians into our community as people graduate from our wonderful university, from the School of Medicine, and from our social work programs, keeping those individuals in the community and engaged and providing services right here is so important.
Right, and what you do is a wraparound service too. It's pretty unique to this area. Just describe for me the patient experience at Hopes and kind of how it's different from what you get at a more traditional facility.
Yeah, I like to believe that it really is a unique model. So when we look at health, we think of it in a very holistic manner. And that means that we address things more than just someone's diabetes or their hypertension or their behavioral health challenges. Instead, we're looking at, does somebody have transportation to make it to their medical appointment? Does somebody have housing? We have a financial wellness clinic that works with lower income and working poor to help them make budgets and learn how to stay out of the payday loan cycles and some of those pieces. So really looking at it from a very holistic standpoint and saying we need to address everything, and then that in turn improves health outcomes, which in the community as a whole, that saves money, keeps people from going to the emergency room and ending up in the hospital.
That's exactly right. I mean, more financial stability means they might actually be able to afford health insurance, which means they might be able to afford preventive care.
Yes.
All the things that will make them less expensive down the line. But doing that stuff costs money, and that's why I think it's so hard to get this stuff funded on a large scale, because someone's got to foot the bill to begin with.
Yeah.
That's where you come in. How do you do it?
You know, it's tough. It's with a lot of support from community members. There's so many individuals in our community that are caring and want to see a healthy community as a whole, and know that by supporting organizations like HOPES, that the outcome is large for the entire community. In addition, we have wonderful support from foundations, local foundations, and continue to strengthen those relationships. And then we also receive a lot of grants from both federal, state, county, local grants to help us keep the operations and provide a lot of these services, so many of them that aren't billable.
Yeah. Now, you take patients, of course, who don't have insurance, but you also take patients who do have insurance. And I remember we had a conversation a while back where you said that the hope was that people who do have insurance would come and utilize the services, so it would kind of offset the cost for those who don't. Did that end up playing out that way?
It does. We do have commercial-based insurance individuals that come and access care at HOPES. One of the really neat things about being a community health center is that our board of directors, 51% of the board of directors needs to access services at the clinic. That's not something that's typical on board of directors that serve different organizations. And so what's neat is that we have folks that actually are experiencing this very holistic approach to care, and individuals that, you know, working professionals that are coming there, and, you know, we deliver your medications to you at work if you need that. You know, we'll pick up your mother and drive her to the appointment while you are at work. And so it really is a benefit, and everybody that comes feels taken care of, and at the same time you're getting something, but you're giving something also.
No wonder you guys are growing. I mean, I know so many people who, you know, could use service like that. I mean, ideally that's kind of how it would be across the board. Why isn't it?
You know, I think that the model of healthcare is moving more and more to this kind of inclusive wraparound service, really looking at what's called the social determinants of health. And as we move away from being paid in healthcare industry for, you know, how many patients are you seeing? So we saw an extreme shift over the last couple of decades, right? Oftentimes, if you go to your primary care provider, the primary care provider can't spend more than 8-10 minutes with you in the room. And so this idea and this shift and this recognition that healthcare should be based on health outcomes, right, and allows us to wrap in these other supportive services. Somebody comes in to see their primary care, they can also see a case manager that day. They can also talk to a behavioral health person. They can schedule their transportation. They can get everything right there. And that's a model that is really going to benefit, and I think people will like the new feel of that when that shift happens, and healthcare organizations are paid based on health outcomes of the populations that they serve. Interesting.
Now, I know a big number of your patients are on Medicaid. I think the Medicare combo is 60-something% of your patients?
Medicaid is about 60.
Medicaid is 60.
And then we do have some Medicare also.
Okay.
Yes, yeah.
So is it a concern at all if I mean, it's been discussed in Washington, D.C. that they could be cutting funding to Medicaid, and that Medicare will likely run out of funding within the next 8 years or so. What happens to you guys in that situation?
You know, it is worrisome, and something that we consistently plan, and we've been very fortunate in our strategic thinking and positioning ourselves by incorporating programs that can generate revenue to help support some of these services. But it's imperative that individuals have insurance coverage and the ability to access care. You know, a lot of our folks are very ill, and they need referrals out to specialists. And, you know, even though we can continue to serve somebody if they lose their coverage, it's awful hard to make a referral to an oncologist if that person has no coverage. Right. And these are people's lives, and those health systems impact their entire family. So it's concerning.
Yeah. All right. Well, how can people help? We have a few minutes left. So what can the community do for you?
I think just knowing about Northern Nevada Hopes. So many individuals that I've run into as we're talking to them, they say, oh, you know, I know somebody at my work, or I know somebody that, you know, works, whatever, however it is that they know them, that could really benefit from this service. So the more people that are talking about community health centers and the impact and the availability and the accessibility, the better for the entire community.
Okay, what about donations, volunteers, anything like that?
Yes, donations are wonderful. Anyone can donate on our website, nnhopes.org, and we appreciate that. Over 90 cents of every dollar goes directly into patient services. And so you know that you're supporting an organization that is fiscally responsible and making an impact.
Yeah, here locally too. I mean, it's
Yes.
right here, it's helping your neighbors.
Yep.
Okay, anything else you'd like the public to know before we go to break?
I think that anyone that needs care, as you were saying earlier, and wants to experience care in a different model, come to Hopes and give us a try, and you'll be pleasantly surprised and be helping your neighbor at the same time.
Absolutely. Okay, Sharon, thank you so much for your time. I sure appreciate it.
Thank you.
And thank you for all that you guys do.
Thank you.
Alrighty, well that is it for this episode of Face the State, but for more information on all of this or to see past episodes, you can just head to our website, that's ktvn.com. Thank you so much for being with us. We'll see you next week.